Thinking about getting an injection for your disc herniation, for your low back, right here for your sciatica? Well, my name is Dr. Grant Elliott, here to talk to you about disc herniations and sciatica and injections and why you might want to rethink those things. So injections, they're one of the most expensive Band-Aids ever, okay? Now, it's not that these could never be helpful, because there are unique circumstances where there might be, but about 99% of people out there with disc herniations, low back issues that go and get injections, they're not indicated. They hardly help. Out of all the people across the world that I've talked to with low back issues and done online coaching with that have received injection, obviously none of them benefited because they're talking to me, and I've hardly met anyone who have actually benefited from these. So these numb the pain. These just numb it. It's just just imagine you're putting a pain relief cream on there. But this is not changing the way you move, your habits, your understanding of the low back, your education, your strength, your mobility. It doesn't affect any of those things. This isn't going to do that. It's not going to do that. You need something that's going to last long term, and injections do not last long term. They never do, and they're expensive. So, if you've already tried conservative therapy, conservative means, rehab, if you've gone through a serious rehab program and you're still not getting results, then maybe someone like me would tell you, all right, well, maybe you should go consider an injection. But for the most part, we can resolve these things in the comfort and convenience of your own home without the need for invasive procedures, injections, drugs, surgery. We want to prevent these things. You don't want to be reliant on this. You want to take things into your own hands. You want to know how to fix yourself. You want to know how to keep it that way. And this, it's not going to teach you how to keep it that way. Let's fix your low back. Come on, let's do it the right way.